My name is Maria Felix,
My name is Alex Fajardo.
and today we're going to be talking about toxic leaders and how they affect work environments. So to start off, what is a toxic environment? A toxic environment is a term we use to describe a work atmosphere that inhibits employees from job satisfaction, develops negative attitudes, prevents career growth, and lacks ethical leadership. Who can make a work environment toxic? In the workplace leadership, such as managers, supervisors, and even coworkers, can do this. And other factors within a toxic work environment are also, but not limited to, atmospheres with unequal pay, discrimination, sexual harassment, and supervisional abuse from leaders within the organization. So what does it cause? Lack of job satisfaction, mental health issues, loss of employee morale, work-life conflict, lowered employee productivity, and high turnover. In a recent study done by the Career Expert, about 65% of US workers are happy with their job, but also about 26% of American employees want to leave their current jobs. Lack of job satisfaction can also be related to mental health. Most individuals who say they're unsatisfied with their job are also likely to have health issues that can include lower back pain, headaches, sleep problems, fatigue, and gastrointestinal issues. Including mental health in a negative work environment, bullying is a factor of workplace toxicity. Mental health can be greatly affected by gossip, sabotage, humiliation, and criticism within the workplace. Harassment in the workplace also consists of unsolicited comments of race, sex, religion, beliefs, age, and much more. This type of harassment can make an individual feel humiliated and can violate the individual's dignity. Nonetheless, both of these can deteriorate an individual's mental health, along with increasing willingness to continue to work productively within the organization. So in order to better the environment, character traits of negative leadership must be recognized. As we talked about in class, the dark triad, we see these types of leaders that we do not want to have in an organization because these are the types of leaders that can manipulate and use employees for their own benefit. And within the research that we found, workplace deviance can be correlated to abusive supervision. So these types of leaders are narcissistic leaders who are selfish, arrogant, and feel entitled. They can push you to feeling inferior and lack any empathy. Psychopath leaders are also heartless, antisocial, and manipulative. And Machiavellian leaders are cynical, along with being power and money hungry, and they are super manipulators and will trick anyone into doing what they want. So within the workplace, having the negative effects of toxic leadership can decrease employee satisfaction along with influencing unethical employee behavior. Employees are actually more likely to engage in gossip and criticize one another when they are in a toxic work environment and their leadership is no help with them. Within positive leadership, it increases organizational productivity, high satisfaction, and establishes a ethical workplace culture.
So when we're talking about dealing with work environments and especially negative ones, we want to know certain ways and how we can cope with dealing with those environments. So when dealing with toxic environments, there is something called negative affectivity. This can be described as a personality trait that really revolves around negative emotions and experiences and a poor self-concept. So these are going to be the types of people in your work environment that are always putting others down, whether it be your coworkers or your management team. They're going to be the ones speaking ill maybe of your coworkers or even of the customers in said career. And they're going to be the ones at the center of main conflicts, as they're probably going to be the aggressors in this case. In this way, negative affectivity does inflate the relationship between work stress and psychological symptoms. So work stress has a direct effect on our mental health, as we've stated before, and can actually have a direct health on our physical well-being as well, and can be the root for some diseases and illnesses. Again, this tends to, negative affectivity tends to be experienced in high levels of distress. due to their negative perceptions and their negative way of thinking. Coping is obviously different across every individual, and people are going to be able to handle different amounts of stress differently. So, this actually determines the nature and magnitude of our responses to said work stress. Men and women do differ in selecting their coping strategies and effort. Men tend to take a more directive approach towards their problems, while women tend to take a more emotionally lax approach towards their issues, which I'm going to demonstrate in the next slide. And then also mediators or moderators in this case in the work stress process can be things such as personality traits, workplace expectations, and even physique. So main versus interactive affecting coping on mental health. So there are two models stated in our research that we found counterproductive in dealing with stress outcomes. So the first one is going to be the main effect or additive model. This speaks about the relations between outcomes and are independent of levels of stress. So these are really going to depend heavily on individual well-being and necessity. It's not really going to focus on the environment or how high stress level it is. So this model is assumed in many cases of IO research and is used predominantly in that field. The other interactive model is called the moderator variable, and this actually influences relations between stresses and outcomes. So in this case, we're going to see more active coping mechanisms and instrumental ones as well. And we can also see that outside support, whether it be from family members, friends, or even inside coworkers and management teams, is going to have a positive influence on those factors. So which coping responses mitigate work stress effects? As we stated before in the other slide, men and women do differ in their coping strategies. Men do take a more directive or direct coping strategy. They're more active and problem focused. If they utilize this correctly, it can greatly moderate work stress effects and decrease the amount of stress felt. I did put a little example at the end saying, I will make a plan of action and follow through. That's just kind of the mentality that somebody of a direct coping would take. On the suppressive side, which is what we said women are more prone to doing, is going to be an emotionally focused coping. This can actually impair your psychological well-being as they tend to push issues aside and not really address the core of what's really going on. So I also included a quotation saying, I wish this situation would go away. It really places blame on the externalized situation, and it doesn't really internalize how she could solve it in any other way. Work stressors in this case can involve, well, the two main ones in the research findings are going to be high work demand, which is going to be quantitative overload, and then lack of social support from peers and or colleagues, which can again be coworkers and or management teams. So how jobs affect health. So we know that when we have bad jobs, they make us feel bad. When we have good jobs, they make us feel great. So we could see a few factors that fall into both categories. Bad jobs equate to poor health. This can be seen with negativity biases, neuroticism. So again, the just inability to have a positive mindset. Working later or night shifts also has a very directly negative effect on health. Working more than 45 hours a week, having high stress load and high pressured positions to perform well, and even physical risks and demands. For good jobs, we could see that it's directly correlated with better health. This can involve things such as self-employment, where a lot of responsibility falls on themselves and they have more direction and control in their career life. A high status occupation, which requires usually a high level of intelligence or either a high level of education, variety in task assignments, high levels of extroversion, and of course, higher wages. So research findings. So our articles all put together actually found that employees who rank high on a neuroticism scale, which is again going to be those counterproductive attitudes and more negative affectivity biases, their constraint measures actually reported less positive feelings towards their job regarding health outcomes. So again, serious ongoing stress at work is highly associated with these negative risk factors and can exacerbate these negative feelings towards the workplace. Employees who actually ranked higher on the extroversion scale, which is being very open, one-on-one, and outgoing with your coworkers and your management teams and customers as well, they were more significantly likely to report positive feelings towards their job. And these employees actually demonstrated more positive perceptions on situations and any conflicts that would arise in the workplace more often than the employees who focus on the neuroticism part of their career paths.